My name is Alison Oliva, and I'm presenting our project, Beecher's Bombshell, How One Man Revolutionized Medical and Surgical Ethics. Although consideration of ethical guidelines for the medical profession date back to the Hippocratic Oath in 400 BCE, formal discussion of research ethics was rare before the expansion of human subjects research in the 20th century. Calls for mandatory informed consent for research participants entered the conversation following the elucidation of atrocities inflicted by Nazi scientists upon their subjects at Nuremberg trials in 1947. American researchers generally opposed mandated informed consent in subsequent deliberations on research ethics in Helsinki, believing it to unfairly impose limitations on innovation by ethical researchers as punishment for the sins of war criminals. Henry Beecher revealed that unethical studies were far more common in the United States than those researchers contested in his talk at the Upjohn Pharmaceutical Conference at Brook Lodge in 1965. His 40-minute talk discussed the abrogation of ethical responsibility among American researchers, citing 18 of the most egregious examples in the published literature. Thomas Chalmers and David Rutstein, two conference attendees and fellow researchers, held a press conference the following day refuting Beecher's findings and accusing him of gross and irresponsible exaggeration. In response, Beecher published an article a year later in June 1966 in the New England Journal of Medicine, outlining 22 examples of egregious ethical violations. He purposefully did not name names to protect the identity of the investigators, although many were well-known, recognizable studies that had appeared in and passed through the editorial boards of the most prestigious medical journals in the country. Many had also received federal funding. Of the 22 studies, 3 were explicitly surgical, and a further 8 required surgical techniques, placing 50% of Beecher's examples in the surgical realm. What most galled Beecher was the lack of any real informed consent and the willingness of researchers to cause real harm to subjects without the possibility of benefiting them as individuals for the sake of science. Immediately following the report, prominent newspapers published stories that fanned the flames ignited by Beecher's report on unethical human subject studies. Clinicians generally supported Beecher, aghast at the horrors committed within their own country, while researchers pushed back on his claims. The public, both shocked and infuriated by the cited studies, was scathingly critical of clinical research and developed mounting distrust of the medical profession. In response to public outcry, the NIH passed a proposal establishing guidelines for patient rights and informed consent in all NIH-sponsored human subjects research. After exposure of the Tuskegee syphilis study in 1972, the National Research Act established the National Commission for the Protection of Human Subjects, which would go on to release the Belmont Report in 1979. This report established the principles guiding federal oversight of clinical research, which became law with the passage of the Common Rule in 1981, formally requiring IRB approval for human subjects research.